So changing the paradigm of how we view health is really hard, because when you view health as a privilege, then that's when you end up dealing with the disease state, because you're only going to have healthcare come in when people get sick. When you view health as a right, that's when you understand that people deserve to have preventative services and before they get sick. So it's going to require for us to want to have a healthy society, and that's kind of the mentality that we need to get in. So my experience at the Adolescent Health Center is in contrast to my experience when I was in the South Bronx, which was working with adult patients at was at a sliding scale clinic, so it was still affordable, but it was a lot more restricted in terms of the services that we were able to provide for our patients. The other part that made it complicated is that our patients had much more complicated lives and health statuses because they were adults. So we had patients that had a lot of the same stuff as my teens do now, where they've had histories of sexual abuse, physical abuse as well, have grown up in violent neighborhoods, many of them have known people, had people in the family be incarcerated, have broken homes in many ways, and despite that were working really hard to live right by life. Many of them were working jobs, were getting their kids through school, were raising families, were working really, really hard, to the point where some of them would walk through the door, especially the ones that I kind of started to know more and more as I learned more and more of their stories. They'd walk through my door, and the first thing that I would think is, how are you standing there in front of me acting like everything is normal? Like the pressures that some of these folks were under were incredible. And they had, some of them had significant medical problems that I would have to address, but I wanted to address so much more than that. And I really felt like people deserved and needed to have many more of their issues dealt with, but I had 15 minutes with them, and I had to deal with the diabetes or the high blood pressure. And the frustrating part was that I didn't have any recourse to refer them to other services, social work services, psychologist or whoever it was, even though it would have affected their health probably more than the pill that I prescribed for them. But I couldn't do it because the system isn't set up that way. It's set up for when people get sick, not before. It's not very helpful in preventing those things from happening. So it was really challenging. It was really frustrating as someone who went into medicine specifically to be able to enable people's health, and I couldn't do that very well. And I know that it can be done better, because for example, working at the clinic that I do now, I see that it's being done better, and I grew up in Canada, so I know that it's possible as a country to do it better for cheaper than we're doing it now. So it's frustrating not having that be available to me as a physician.